We'd also like to make a presentation to Mr. Baptiste, the interim president and CEO. Mr. Baptiste, when we shared our vision of a public cord blood program here at St. Francis with you, you immediately understood our mission and our sense of urgency and embraced it. Your leadership and commitment to the success of this life-saving program has been key, and not only in our implementing this program in record time, but it will also be instrumental in the long-term success of this program. So we ask that you accept it. I would be remiss if I didn't take a moment to recognize Joan Caruso, the legal counsel. Here at St. Francis, it took us over 18 months to make this partnership happen today, and it was all because of Joan's dedication and her persistence. So I'm eternally grateful to you, Joan. Thank you so much. Before I share with you a few thoughts about our son Brady, I'd like to take a moment to recognize and thank our board members and our volunteers who are here today. Many who have brought their children who have donated their cord blood as well. So you see a lot of little ones running around, and most of them have donated their cord blood. They are wonderful examples of our mission. And finally, I'd like to recognize and thank the president of the Brady Kohn Foundation, Kendall Massett. As a volunteer-driven organization, we rely on the passion and the dedication of our volunteers to further our mission. Kendall is all of that and more. As president, she has provided strong leadership and vision to our work, allowing us to achieve more than we ever believed possible in such a short period of time. Kendall played a key role behind the scenes in enabling this day to happen. And as we celebrate the launching of our public cord blood program here today at St. Francis, we also are proud to launch our brand new foundation's website today. This clearly was a labor of love. So Kendall, thank you for all you've done. My husband and I want to share just a few thoughts about our son Brady with all of you today, because without him, we certainly know we would not be here launching this program. In September of 2001, at just the tender age of 28 months, our son Brady acquired an unknown virus that shut down his bone marrow, and he developed aplastic anemia. After an unsuccessful drug treatment, Brady underwent a cord blood transplant at the University of Minnesota. His transplant was medically significant because Brady was one of the first patients in the world to receive an autologous cord blood transplant using his own stem cells from his umbilical cord blood that was saved at the time of his birth. Although the signs of the transplant were very promising, we lost our dear son due to complications in March of 2002. Brady was with us far too short a time, and his absence is difficult for us to manage every single day. But while he was with us, he blessed us with his love, his laughter, and most of all, his great sense of humor. And even in his absence, we know his spirit continues to touch the lives of others. Like the young child with leukemia who just last fall received a cord blood transplant using one of the cord blood units saved through the Brady Kohn Foundation Public Umbilical Cord Blood Program at Christiana Hospital. The young patient will never know Brady, his family will never know who we are, or the generous parents who donated their baby's cord blood to save that child's life. But we certainly know that family has been touched by our Brady. And in launching this public cord blood program today here at St. Francis, we know that Brady will continue to touch the lives of many for years to come. We thank all of you, especially our distinguished guests, for being here and being part of the celebration and celebrating our son. At this time, I'd like to introduce to you Dr. Dennis Todd, President and CEO of Community Blood Services. Dr. Todd has been an enthusiastic supporter and advocate of cord blood banking here in Delaware since our organization began partnering with cord blood donations in 2006. Is dedicated to making community blood services one of the premier programs in the U.S. And we are very proud and very thankful to partner.
Thank you, Carol and Andrew. Introduce this Senator, Congressman, County Executive. I want to thank you all for inviting us here to share in this great occasion in this wonderful hospital. My involvement really got started about 40 years ago, almost 40 years ago now, when I was taking a 3-year vacation with the United States Army. And I was introduced in the hospital I was stationed to a couple of children who had diseases that I really didn't know anything about at the time. There were kids that had leukemia, and there was one child that had sickle cell disease. I got to know them, and I also had the misfortune of seeing them die at that point in time. The treatment for things like leukemia just didn't exist. And it was through all of the hard work of the doctors and clinical scientists and nurses that work in the pediatric field that we made the advances that we see today, and that a child that has leukemia doesn't necessarily have to die. As a matter of fact, it's very rare that they do. I was attracted to the blood center about 9 years ago when I found out about their cord blood program. I had gotten interested in stem cells as a scientist, and I was fascinated with what they were trying to accomplish. And when I had the good fortune of joining, this really turned out to be one of the gems of the blood center and the work that we do. Besides supplying hospitals with blood and platelets and things that they need to take care of their patients, we're also working with groups like the Brady Kohn Foundation, the volunteers there, the nurses, the doctors, and the other medical professionals to help convince these moms and help these moms make the donations that they make today. If you're an African American in this country, anywhere in the world, the chances of you finding a match in the bone marrow donor registry are about 20%. If you're white, it's about 70 to 80%. So there's a lot of minorities out there, individuals that are ethnic or racial minorities that are really behind the 8 ball. And it's through programs like this which really give them the advantage. And I'm attending a meeting tomorrow in Montreal where we're going to be talking a little bit more about some of the advances that have taken place. And one of the things that we have seen is through the use of cord blood, the number of African American transplants and Hispanic transplants that are facilitated by the National Marrow Donor Program are growing exponentially. And that's the fact is that once the mom makes the decision that she's going to donate that life-saving bag of blood that contains these adult stem cells, they get processed in our laboratories, they get stored away, and the minute that they find a donor, we can ship them out and help save a life. As compared to the way we do it presently with peripheral stem cells or with bone marrows, which could take up to a month or two. And in that period of time, the patient could go in the wrong direction and really not have a chance in life. So we are extremely excited about being able to partner with St. Francis Hospital and the Brady Kohn Foundation. They do the hard work. They have to deal with the moms, and they have to get them to, they have to coordinate the collection and get it to us. We do the easy part, and that's to process the cells and store away the nitrogen, and then make it available whenever, and we have a team that works with the transplant centers to get it out. So we are looking forward to a very long and hopefully very good relationship with St. Francis, as we have had over the years, the past 3 to 4 years with the Brady Kohn Foundation here in Delaware. So again, I want to thank you very much for allowing us to work with you, and we look forward to having many more of these types of visits. Thank you.
St. Francis Hospital is fortunate to have the support of Senator Tom Carper and Congressman Brady. They have worked tirelessly over the years to secure millions of dollars in the hospital, which have helped the hospital to purchase and fund our da Vinci robot, also build our new emergency department and the heart center. In addition to that, they've secured hundreds of thousands of dollars over the years for our cornerstone program, the mission program that we have here at the hospital. And we're very thankful to have them here in the community support initiative that we have here at the hospital.